with Dr. Jaimie Ronchetto from Cinema Veterinary Center. And welcome back.
Thank you. Good morning.
And now I want to talk about this. I have an older dog. He's just turned 14 in June, but I've seen a lot like social media posts where people, I don't know about my Betsy or my buddy or my Rover, and it might be that time. And it turns out that fortunately for them, it was either something that just maybe was something anywhere from a minor thing to something major, but something major that was either curable or manageable that actually extended the life of a dog. So. Or even cat for that matter. But there is that time, doctor, when it's like, as they get older, what is it that makes that determination as to whether or not it's something that we can fix, whether it's our older dog or even younger dogs? Are there signs that we look for that if something is terminal versus curable or manageable?
Right. Really good question. And it's one that we get a lot. You want to make sure that your pet is healthy and happy. And as they get older, sometimes it's harder to determine that just on your own, watching them at home. Older pets tend to slow down, and some of that can be quote unquote normal aging, but oftentimes it's not. So if you find that your aging pet is kind of slowing down, especially rapidly, having a hard time getting up, changes with their diet, things like that, then it's really important to have them come in for an exam. Typically we'll want to do some blood work, and that's really important so we can see different organ function, make sure that their liver and their kidneys and thyroid are all normal, and check for other kind of markers, certainly cancer markers, infection, anything like that, and get a full wellness checkup. Oftentimes, if they're not eating well, sometimes they have really bad teeth or one infected tooth, and with some dental care and antibiotics, we can fix that. Oftentimes on blood work, we might see that their kidneys aren't working as well as they used to, which, with kidney disease, it's not something that's typically completely fixable, but it's definitely manageable. So making changes like that, we can make sure that their quality of life is good.
And also talking about behavior changes too, whether they went from being happy to suddenly really sullen or even a little bit aggressive, or
Yes.
doing things if they're potty trained and suddenly they're going in the house and things like that. Those can be signs of something that is not right too, correct?
Absolutely. Certainly if they're painful anywhere, if they have joint pain, if they have arthritis, they can get grumpy or aggressive and sometimes hide away too and not be as social. So making sure that they're comfortable, getting them on any medications or supplements needed to help protect their joints and bring down inflammation can make them that happy social dog or cat again. And certainly the very senior pets, both dogs and cats, can get senility, just like people can. So they can get confused and forget potty training or forget to use their litter box. And sometimes that seems to be worse at night, their confusion. So you may find that they are kind of wandering around, and almost like when you go in a room and you forget why you came in there,
Exactly. Exactly. Well, what am I doing here? Yeah.
Yeah.
I have my 14-year-old likes to get up a lot in the middle of the night now, and I think maybe that's just old man type stuff because old men kind of do that. Mm-hmm. On the other end, is there a time when you have possibly have patients who aren't ready to accept that it may be the end, and they want to try and do things to continue to keep their pet alive, even if the quality of life is not where it should be? Is there a line to be drawn, or is that something on a personal level for the pet owner?
Yeah, and that's really hard, and it's definitely personal and individual. Me as a doctor and from the medical side, we can show an owner everything, the writing sort of on the wall, and humane euthanasia may be the best thing for their pet at that point, but they have to be ready too. So if they're just not quite ready to let go, a lot of times we can help make that pet comfortable until they are ready. Oftentimes they just need a couple days to kind of digest the information and kind of have that closure.
Well, it's good to know, of course, first and foremost, no matter what, check with your veterinarian if you are
Yes.
seeing signs. Don't get overtly emotional or panicky if there are big signs, because in just as in humans, there are things that could be easily fixed or at least manageable.
Right.
And like I said, I know people who have posted, oh, I think that's it for my baby. And then it turns out, even if it was cancer or something like that, they've had a complete turnaround, and there are
Right.
things you can do. So it's always good to check with your vet first. Cinema Veterinary Center, located on Cinema Drive in beautiful downtown Valencia. Cinemavet.com. Phone number.
661-253-9300.
And as someone who has brought their pets to Dr. Ronchetto, I can personally attest and vouch for their level of service and professionalism. So it's
Thank
really
you.
awesome.